Welcome back, it's Dr. Mivi Singh, and what are some of the craziest things that people actually swallow, even including children? But there are lots of patients who have mental health conditions that actually swallow different types of dangerous objects. So what are they? Includes things which are dangerous, to those things that look dangerous, to those things which are actually dangerous and are an emergency. So what's the difference? Well, people may swallow sharp objects like screws, nuts, bolts, shards of glass, pieces of metal, all these different types of objects. Some people do it because they've got mental health conditions. Some people do it to hurt themselves. Some people do it because it's an accident, because they might be intoxicated or even high on drugs. And then you have children. Children do it because they don't know. They are too young to even comprehend some of the dangers. Lots of different objects out there are not actually dangerous in the emergency circumstance. They may look dangerous because they're sharp, or they may look a certain size or shape, but they don't actually cause much of a problem, and they pass through the body and they come out the other side. Some of them may even hang around inside the body for such a long period of time that they hang around in the body that they don't actually even cause a problem. Now, some of those sharp objects you may be thinking, but they might actually cause a problem. Yes, they could do, but they don't need to be taken out immediately. That is because some of the only ways to take out these objects is by putting a telescope in through the mouth, going through the food pipe into the stomach. And that is not just a normal procedure. It does have its own dangers, and it's putting a patient at risk. And therefore, if the patient is not suffering certain signs and symptoms, for example, pain, vomiting, or other signs of an emergency, which could include something called a perforation, which is where you literally pop a hole in that part of the bowel, even the esophagus, then it is understandable to do these types of emergency procedures to take those objects out, because you have to fix the problem and the complication. But when it's not causing an issue, it's actually safer to leave those objects in. Those objects which are a serious medical emergency that need to be dealt with super urgently in the emergency department are objects such as button batteries, because they can cause severe burns, and that can happen within minutes. Here is a video I did before that shows you how quickly these types of burns can occur, and they can damage the food pipe, the stomach, or the rest of the bowel. That could lead to serious complications, and people in the past, including children and adults, have suffered so seriously that they've needed to have bowel surgery, even including going and having to stay on the intensive care unit afterwards. So these types of objects like button batteries need to be removed straight away. One of the other objects that needs to be removed straight away are magnets, and it's not just a single magnet, it's actually if there's two magnets together. And that's because imagine if it's in a tube and you've got a magnet on either side. What can happen is those magnets can join together and therefore cause a loop which is blocked off in the bowel. That means you have a bowel obstruction. That's a bowel blockage. And if that is not relieved, the bowel itself can burst, and that is a serious complication. Another type of object that needs to be removed is those types of objects. Some of them are toys, some of them actually are used as air fresheners, some are actually used in other types of devices, but they are what we call water expandable objects. These are objects or devices which are absolutely tiny, and actually some of them come in children's toys. And what happens is you put them in water and they expand. Some of them can expand to 100 times their size. So here's another video that I did and showed earlier on in what happens and how it can block the bowel. This is one of the objects inside a tube, and look how quickly it grows when water is added to it. That can block the bowel, and that can damage the blood supply, cause a blockage, cause a rupture of the bowel. So these are really serious consequences. These types of objects need to be avoided. Children need to be kept away from them, and to be honest, children don't need to be going near these types of objects. You just never know. You turn your head and 2 seconds later a child has done something because they are curious and it's not their fault. That was a quick roundup of today's emergency department by Dr. Mivi Singh. Watch out for more, and make sure you like, share and subscribe to help grow this channel and grow this community. And watch out for some of my other videos that will be coming about some of the most interesting and dangerous objects that people have swallowed. Thanks for watching. Stay blessed.